Hello, I'm Karen, and this is my presentation for the examination of a pregnant patient. I have here a patient who is already in a semi-sitting position and also dressed in a gown and already draped. Okay, so I'll begin with inspection. So ma'am, can I lift your gown to expose your abdomen? Okay. So this is just until the level of the xiphoid process. And as you can see, the patient is already draped just at the level of the symphysis pubis and the genital areas are covered. Now that we have the exposed abdomen, I'll begin with inspection. So I'm looking for signs of linea nigra, stria gravidarum, and also for previous signs of scars or old scars from previous surgeries or C-section, and I don't see one here. I'll proceed with palpation of the abdomen. So I have to take note of the organs and masses. Also, it's normal to feel fetal movements at this age of gestation, and also for irregular contractions and relaxations for the uterine contraction. I'm going to palpate for the fundus, which is the topmost part of the uterus. Okay, so I feel a little bit of resistance here, and this is where we have the fundus of the patient. So I'm going to measure for the pubic height using my tape measure in centimeters. So this is measured from the symphysis pubis up to the topmost part. So this is 30 centimeters, and 30 centimeters can be correlated with the fetal gestational age, which can be also 30 weeks of gestation. Next, I'll proceed with further palpation using the Repulse Maneuver. So I'll begin with the first maneuver. For the fundal grip, so to determine the fetal part here, so I feel that this area is a bit soft with a bit of bony prominences. So this could be the fetal buttocks. Next, I'm going to palpate at the sides of the abdomen. Shh, quiet. Okay, so I'm going to palpate first at the side. Okay, so there are irregularities and it's not so smooth. So this part here, which is at the patient's left side, is the fetal extremities. And on the other side, so it's grilled and smooth, which means that this is the fetal back at the patient's right side. Next, for the third maneuver, so I'm going to place my thumb and finger just above the symphysis pubis, trying to palpate this area here. So it's kind of firm, which suggests that this part here is the fetal head. And for the last maneuver, facing the patient's feet, I'm going to place my hand here. So starting with the right hand, I'm going to press downward and inward. And then for the other side, pressing downward and inward also. Okay, so at this part, this is where the fetal brow is, which signifies this is where the fetal, the cephalic prominence is. Okay, and lastly, I'm going to hear for the fetal heartbeat. So I'm going to use, yes, quiet. Going to use my stethoscope for this one. And at 30 weeks gestation, it's best to hear the fetal heart rate at the fetal back. So I'm going to use the well of my stethoscope. At 30 weeks gestation, the fetal heart rate of 160 beats per minute is considered normal. So this ends the examination. I'm going to return the gown back to its position, and then you can now get dressed, and then you can come back and we can further discuss your case. Thank you so much for your cooperation. Bye na daw, princess! Bye na, dali! Dali!
Bye-bye.